Hello, thank you for joining me. This is one of the beginning recordings that I'm creating for my YouTube channel. And today I was pondering names, just thinking about what am I going to call this? And the OT meeting room came to me. And I really like the way that sounds because when I was an occupational therapy student, I remember doing this amazing field work with a woman who worked for a couple of different agencies. And it was an early intervention field work. And I remember she was so well connected in the community. And there were people who were really struggling to manage feeding issues. And they started having meetings in someone's home, and they were talking about all things related to feeding. And I loved the energy of being with those those people, those occupational therapy practitioners who were so passionate about their profession and being able to help children and families of children who have feeding issues. And I really enjoyed that part of my field work and being allowed to be a part of that. And so I guess that's kind of what I was thinking about this morning, just thinking about a group of people, occupational therapy practitioners all meeting together. The company that I work for now, I mentioned, I think in one of my other videos, that I have worked in multiple levels of care. And the company that I work for now had at the time a therapy float pool. And I was fortunate to work in that therapy float pool, which is how I got this amazing experience just working in all levels of care. And when I was working in that position, we started an OT discussion group, and we would meet once a month. And it was just such a cool thing to be in this large room with all of these amazing occupational therapy practitioners. And everybody had these different levels of experience, different types of experience, different years of experience. And we came together, and it was just amazing. It was just amazing to be in this room of people who were very interested in learning more about whatever the topic of the meeting was. Um, I remember there were changes in supervision of COTA supervision in our state at the time. So this is going back a few years ago. And we had an amazing leader. We had this amazing occupational therapist who led us and who cared about us abiding by the guidelines that the state was putting out and helping us to know what those guidelines were, and so that we can abide by our Practice Act. And it felt very empowering. And so that's my hope for the videos that I'm making, is that we empower each other and that we talk about things that are important to us as occupational therapy practitioners. If you do choose to watch these videos, I encourage you to comment, place your comments in the comment section, share your thoughts, ask for topics to be discussed. And if you have ideas, if you have other ideas that you would like to see me talk about or even do, then please share your ideas in the comments. I do ask that you share them respectfully. As you may or may not know, it's a little challenging to put oneself out in front of the world in a capacity where you're talking and being. And as an OTA instructor, I will tell you that I always ask my students when they give me feedback to please make it meaningful feedback. And if you do put a critique, a criticism, I ask that you use kind words and provide me with a suggestion of what you would like to see. And if you don't know what that is, then please state, I don't know what that is, but use kind words, because it's tough. As you may or may not know, it can be difficult to receive a criticism stated in a harsh way. So I ask that you be kind, but I definitely want this to be a conversation. I want it to be where we are in a meeting room of all of us amazing occupational therapy practitioners talking about our experiences and using our experiences to help advance our profession and help advance ourselves as clinicians, helping us to be better, show up as our best selves every day to work, and supporting each other and our colleagues as well. So that in doing that, people will know what an amazing profession we have. So those are my thoughts on what this is evolving into, these videos are evolving into. And before I sign off, I want to leave you with a story about an amazing experience that I had at the hospital the other day. I have mentioned that we are a stroke center, and as a result of being a stroke center, we have a specific dedicated stroke unit on our hospital. And it is currently, we're currently in the COVID time frame. And as a result, we have some hospital practitioners on the medical end of the spectrum who, like physicians, nurse practitioners, those people who are wanting to help discharge our patients quickly and safely. And occupational therapy was actually called for. They called the rehab department office, specifically asking for the OT to come and see a patient who was evaluated the day before, and address some of the issues that the patient had going on, and to see if we could come up with a safe discharge plan for this person. And it was just amazing, because the nurse practitioner who was there the other day, she understands occupational therapy, what we do and what we bring to the table, and she highly values it. And she really understands the vision and the cognitive component and the importance of what we bring to the table in terms of recommendations for discharge. And in another video that I had made, I told you about a person who had specifically said to me that they don't look at the OT notes. Well, this particular nurse practitioner, as well as the patient's nurse, asked me to please document my findings because they were waiting for the OT notes. And I just wanted to tell you that, because in times where we know our own value, but not everybody else does know our value, people are knowing what our value is. There are people out there in the world who understand the value of the occupational therapy profession and what we bring to the table. So keep up your conversations. Remember who you are and remember what you know. And if you know that you know something, but you're not quite sure how to use what you know, hopefully you feel comfortable posting that in the comment section, and I can create some videos to help you know how to apply your knowledge, or that's how I feel like I can help you. On a more personal level, it would be great if you can find yourself an occupational therapy mentor, because mentors, they love teaching. There are people out there who just love sharing their knowledge, and they love helping other people develop their skills. And hopefully you can find a person like that in your local community. So I'm going to sign off for now. Thank you for listening, and welcome officially to the OT meeting room. Have a fabulous day.